Who remembers Kent Brantley, the doctor who was flown in from a medical outreach in Liberia into the United States soil as the first person with Ebola virus? The Ebola disease is a very severe disease with a high fatality rate. He was flown to the Emory University Hospital, where a multidisciplinary team, which included 21 critical care nurses, took care of him. The demands of the job were such that they changed the 12-hour shift to an 8-hour shift so that they are able to meet the demands of the job. Critical care is a part of nursing where the nurses take care of the sickest patients in the hospital, and there has been an increasing need in that specialty, especially with the shortage of nurses in the hospital. Critical care is an intense level of care. The recommended nurse to patient ratio by the American Association of Critical Care Nurses is 1 nurse to 1 or 2 patients. Currently, hospitals are beginning to experience 1 nurse to 3 or even 4 patients. This compromises the safety and outcome of the patient, and it also increases the high workload of the nurses. This leads to nurse burnout, nurses quit at the end of the day, and thereby creating even another vacuum to fill. To explain this further, when the workload of a nurse is increased by 1 patient, that patient is likely to die within 30 days for admission. All hope is not lost, as I now address one of the keys to the solution of this problem. I mean the new nursing graduates. These make up 42% of the national new hire workforce annually. During the COVID-19, there were a shortage of nurses, but at the same time, many people applied into nursing schools, and they are now the new graduate nurses that I address. Nursing residency programs have been put in place for these new nurses. They run between 20 to 24 weeks. This allowed the new nursing graduates to learn skills and to practice under the watch of a preceptor so that they are not overwhelmed with the new job demands. Gone are the days when you need to have experience before you are hired into the intensive care unit. With this new hire of new graduate nurses, there is reduction in the nurse shortage. Imagine that intensive care unit nurses save lives every day, literally. Therefore, this nursing residency program in the critical care, it gives the new graduate nurses an opportunity to take care of the sickest patients in the hospital while reducing the stress and anxiety that comes with a new job. Nursing shortage is a vicious circle, so that when there is a shortage, the nurse becomes overwhelmed. When they quit, it creates even more shortage. But with this new graduate nurses hire into the critical care unit, that vicious circle is halted. What do we do? How do we put this into action? We may have loved ones in the ICU, and we will want them to be taken care of properly. It starts with you, new graduate nurse. All you have to do is to apply to the hospitals that are offering this residency program in the ICU and tell them that your preference is to work in the intensive care unit. The hospital already has a program in place where there will be classes taught and skills, and you'll be attached to a preceptor who will guide you. It is a rare opportunity to be able to take care of people at the lowest point of need. And it also decreases the nursing shortage so that the patient outcome will be favorable.